We all hear about how AI is going to change everything, right? Especially in medicine, spotting diseases way earlier, way more accurately. But what if you had this incredible, life-saving tech and nobody was really using it? That's exactly what seems to be happening in the Netherlands, and it's a real puzzle.
So let's just get right to it with a question that might feel a little uncomfortable. Could an AI actually be a better doctor than a human? I know, it sounds like something straight out of a movie, but you've got to see the data on this. It might just blow your mind.
All right, so to even begin to answer that, we have to look at what these AI systems are capable of. And honestly, when you dig into the performance numbers, they are just staggering.
Okay, check this out. This is a direct, head-to-head comparison. Google put its medical AI, called Amy, to the test, and its final diagnostic accuracy, more than double that of experienced doctors. We're talking people with a decade plus under their belts. I mean, that's not just a small improvement, that is a massive, massive difference.
And it's not just a one-trick pony for general stuff. Let's get specific. You look at something like cardiology, right? An AI can spot heart arrhythmias with 98% accuracy. The very best human cardiologists, they top out at around 83%. That's a huge gap. It's the same deal when you look at skin cancer. An AI hits 92.5% sensitivity for detecting melanoma. That puts it right up there with the top expert dermatologists.
And the pattern just keeps going. In pathology, you've got AI looking at over 150,000 biopsy slides and hitting 96% sensitivity. Again, that's just blowing the average clinician's accuracy out of the water.
So what's the takeaway here? This isn't just a fluke. We're seeing it across the board. Recommending treatments, reading X-rays and ECGs, even cracking those super complex cases from the New England Journal of Medicine, the AI is consistently right there with, or even better than, human experts. The potential is, it's just undeniable.
Okay, so with that kind of firepower, you would absolutely expect a super modern, advanced healthcare system like the one in the Netherlands to be jumping all over this, right? Well, that's where things get really weird. This is where the paradox really kicks in.
And this is the central question we're trying to figure out. We've seen how powerful this stuff is. So why? Why the hesitation? Why are Dutch hospitals seemingly stuck in first gear when this technology could be saving lives, saving money, saving time? You know, this isn't just some abstract, high-level problem. On the ground, it's very real. We're hearing stories from people working in elderly care who are just drowning in paperwork, wrestling with ancient scheduling systems, wasting hours every single day. These are exactly the kinds of problems that AI is built to solve.
And look, this isn't just one person's bad experience. The data tells the same story. A recent survey found that only about one-third, just a third, of radiology centers in the Netherlands are actually using AI tools. So yeah, there's a little bit of growth, but for a whole country, they're pretty much stuck in pilot project mode.
So, to really get to the bottom of this, we've got to look beyond the tech specs and the algorithms. We need to focus on the people, the doctors, the nurses, the clinicians, the ones who are actually supposed to be using this stuff.
In this quote, man, it just nails it. For so many doctors, an AI is just a mysterious black box. It gives you an answer, a diagnosis, but it can't really explain how it got there. And you got to remember, when lives are at stake, trust is everything. You can't just trust a black box.
And this isn't just a feeling a few doctors have. It's a widespread fear. Get this. A survey showed that 62% of clinicians in Europe are genuinely worried about AI making mistakes. That's a huge number, and that worry, it's a massive wall standing in the way of adoption.
A big part of this, it just comes down to a knowledge gap. Think about it. A lot of these experienced doctors, they never saw this stuff in medical school. It wasn't part of their training. So of course, they're going to cling to the methods they know, the skills they've trusted and perfected over their entire careers. It's only natural.
But okay, it's not just about feelings or trust. Let's say every single doctor was 100% on board tomorrow. There are still these massive, practical, systemic roadblocks stopping this from happening. I mean, where do you even start? You've got the insane cost of integrating these new systems. You've got super strict GDPR data privacy rules, which makes training AI really tricky. Then there's the data itself. It's a mess. We're talking fragmented systems, even handwritten notes. On top of all that, hospitals don't have dedicated budgets for this, and the few pilot programs they start just seem to run out of money and fade away. It's a perfect storm for going nowhere.
And then there's the red tape. Bureaucracy is a huge factor. The European Union's new AI Act is all about safety, which is good, but it also adds all these complex layers of regulation that just slow everything down. Compare that to the US, where the FDA has a much faster, more streamlined approval process for these kinds of medical AI tools. It's a night and day difference. So yeah, the situation's pretty complex. It's a mix of human psychology and systemic hurdles. But here's the thing, it's not hopeless, not at all. Because when you can clearly see the problems, you can start to see the solutions. And it all seems to point toward one thing, building a real partnership between doctors and AI.
So what does that path forward actually look like? It seems to boil down to 3 big steps. Step 1, education. We have to empower clinicians, give them the knowledge and training they need to actually trust these systems. Step 2, smarter government policy. The government has to get involved, funding things like shared data platforms and creating real incentives for hospitals to adopt this stuff. And finally, Step 3, collaboration. The AI developers can't just throw the tech over the wall. They need to be in the hospitals, providing hands-on support, running workshops, and really working together with the medical staff.
And if all that happens, it completely reframes the doctor's role in the future. They're not going to be replaced. Instead, they become this vital translator. They take the incredible, data-driven insights from the AI, and then they deliver that information to the patient with all the things an AI can't provide: empathy, context, and real human wisdom.
And that, right there, is the key takeaway. At the end of the day, AI in healthcare isn't about replacing doctors. It's about empowering them. It's about giving them a superpowered tool that handles the heavy-duty data analysis, freeing them up to be even better at the human side of medicine.
So, that leaves us with one big, final question to think about. Is all this hesitation? Is it wise caution? Is it the right thing to do to protect patient safety at all costs? Or is every single day that we spend stuck in pilot mode a missed opportunity, a day where a life that could have been saved wasn't? That's the tough question the Dutch healthcare system and really all of us are going to have to face, and soon.